A production fee for your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.
With COVID-19 vaccines available across the nation, many expecting mothers are concerned about the safety of the vaccine. Pregnant women were not initially part of the clinical trials, resulting in many rumors and misinformation. Pregnant women are at higher risk of severe COVID, but are unsure if the vaccine is safe for them. Today, we'll talk about what pregnant women should know regarding the vaccine and what we know now about COVID-19 and pregnancy. We'll also hear from a woman who contracted the virus when she was 39 weeks pregnant. We'll address this life-saving information you need on this edition of your Hometown Health Connection. I'm Samantha Latshaw. Welcome to your Hometown Health Connection. Many new and expecting mothers are still conflicted about getting a COVID-19 vaccine, and many are forced to navigate through different opinions about the matter from where they are reading on social media, even fearing the vaccines will cause women of childbearing age to become infertile. The reason? Early clinical trials of the vaccine did not include pregnant or breastfeeding women, leaving them confused about whether or not they should get the vaccine. Joining us is Dr. Sarah Berga. Dr. Berga is a national fertility expert, is a professor and chair of the Department of Obstetrics and Gynecology of Jacobs School of Medicine and Biomedical Sciences, medical director of UBMD OBGYN, and Women's Health Program Development at Oshai Children's Hospital and Kaleida Health. We also have Kate Glaser. Kate is the senior manager of brand communications at Make-A-Wish Western New York and the founder of Hope Rises News. Kate was recently featured in a New York Times article after contracting COVID-19 when she was 39 weeks pregnant. She suffered from fevers, chills, body aches, a sore throat, chest tightness, and burning for 2 weeks, and delivered baby Isla with her mask on and supported with oxygen. Dr. Berga and Kate, welcome. Thank you so much for joining us.
Thank you. It's good to be here.
Thank you so much. It's such an exciting topic to have you both here today. A lot of women who perhaps are thinking about getting pregnant or are new mothers, definitely this is top of mind for them.
Right.
Now, Kate, what an amazing story you have. Talk to me about how you think you may have contracted the virus.
You know, to this day, I still have no idea how I contracted the virus. I was very careful. We went even to the point of getting Instacart deliveries to our house. I was working from home. So I still have no idea how I got the virus. I always wear a mask. I continue to do that. So I still don't know. I was going to doctor's appointments, so that could have been where I contracted the virus. But we did take it very seriously, and I really did wear a mask at all points, and contracting it at 39 weeks pregnant obviously is very scary.
Absolutely. Now, how is baby Isla? How was she when she was born? Did she experience any symptoms?
She's doing well today. She's now 8 months, but it was scary during delivery. I had to, like you had mentioned, wear a mask during delivery, so it definitely was a very hard time. At one point, I actually had to get oxygen because of the symptoms that I was going through. I was in the thick of it when I actually delivered her, so my symptoms were pretty drastic. But she's doing so well. She actually got tested for COVID when she was 2 days old, and that was really hard as a mom to see her go through that testing. But it was good because we were informed that she was negative. I don't know if she ended up sort of getting the virus. The test said no, but she was definitely under the weather for a couple of days after she was born. But she's doing so well today, and I'm so happy for that.
That's great news. It's definitely a lot to hear with, having a new baby at home and then having to deal with those unknowns. So happy to hear she's doing well, Kate.
Absolutely, thank you.
Now, Dr. Berga, a lot of women are afraid of taking this vaccine. What are some of the concerns you hear at your practice?
There's so many concerns, and everybody puts it together differently, and we hear the concerns one by one and try to take them very earnestly. And what we know now is just so reassuring about the vaccination. So first of all, it really is helpful, and it's helpful for everybody. So we have professional guidance from lots of organizations, including the American College of OBGYN, who early on really looked at the data, got the leading experts in women's infectious disease from the CDC to weigh in on this topic, and really right from the beginning, we have been recommending vaccination. And over 20,000 women have been vaccinated who are pregnant with no ill effects.
Wow, so a lot of great minds coming together to make this decision. But what are the women saying? What are they saying to you? What are their major concerns?
Everybody's concerns are a little different. It's amazing how the absence of information can lead to a lot of imagination. So people are afraid that the virus will stay with the vaccination in their body, that they'll get the virus that way. The vaccination mRNA, that's what it's called, will stay in their body forever. That's not true. That their eggs will be damaged. That's not true. And a really neglected topic is men's fertility, but most viruses actually do harm men, sperm, and getting vaccinated actually protects both eggs and sperm. So we really want to get the message out. The virus is bad, the vaccination is not.
Wow, the fear of the unknown really makes up people to think, things that aren't really so true, that are pretty far-fetched.
Far-fetched, and you understand, because people are just naturally worried about something that's new. But the problem is the virus is new and the vaccination is new, and the virus is not a very nice virus.
Absolutely. A lot of people are definitely losing their lives to this virus. Now, Kate, did you have some of these same concerns that Dr. Berga expressed?
So when I actually had Isla, it was prior to the vaccine coming out, but I definitely was hoping for the vaccine. I was very pro-vaccine. I thought it would really help. Right now, I know some friends who are pregnant, and they did get the vaccine because they thought they had to protect themselves, their baby, and also people around them who are immune compromised. So I definitely was hopeful for a vaccine. I feel like it really brought a lot of hope to our world.
What about your friends and your friend circle and other women around your age group? What were they saying?
Yeah, I think it's just scary. The unknown is very scary, but sort of the unknown of the virus sort of was just a scary thing. So the vaccine really was something that they were all looking forward to, and I know that they all have received it, and they're happy about that.
Now, Dr. Berga, there is a popular rumor spreading through social media and now proven to be false, stating that the spike protein of the coronavirus is the same as another spike protein that's involved in attaching to the placenta during pregnancy. The report stated that COVID-19 would cause a woman's body to fight this different spike protein and affect her fertility. Now, is there anything in the vaccine that actually affects your fertility? Is this true?
Actually, this is not true. And the sad part is it's if you get the virus, the SARS-CoV-2, during pregnancy, the immune system may attack your placenta and cause preterm labor, or you may get so sick that you go into preterm labor, or you may even have a miscarriage. But the vaccination will not do that. It will protect you from that. So it's really the best route.
Now, what is this spiked protein specifically that everyone is so concerned about?
So I think that's the name coronavirus, those little red things that the illustrators put, those are the spike proteins. And they look very fancy in the illustrators' cartoons. And that is really what the immune system targets. And that is also how the virus kind of lands on cells. So if the immune system can get rid of that spike, then the virus can't do anything. It's really critical. It's sort of the landing gear on the cell, if you will. So, I mean, cells are funny and viruses are funny, and they have to meet up with each other for the virus to get into the cell. This is really the lunar mechanism for landing. It just is a foot. And so if the immune system can actually get rid of the foot, then it can't really get into the cell.
So there's nothing in this vaccine that will cause infertility to a woman who is looking to become pregnant, or for a man either.
So doctors think in something called risk benefit. So we take the risks and we say, okay, risk of vaccination, risk of getting infected with the virus. What are the risks? And the risk of getting infected with the virus are now extremely well known and really bad. I mean, and particularly during pregnancy, because when you're pregnant, the baby compresses your lungs, you can't breathe so well, you need your energy to go to the baby, and the baby is growing, and so you don't want to be sick. Okay, the vaccination gives you a little mild, headache, maybe a day of not feeling so perfect. That's nothing like the virus when you get a true COVID infection. And so you have to think about it. One is hugely different than the vaccination. And that's really what we want people to understand. Nothing in this world is completely risk-free,
right.
But when you compare the two risks, there's no comparison, absolutely no comparison. And remarkably, this virus is hard to prevent, as I think Kate's story is showing. You can do everything you need to do, and still somehow you can get it.
Now, traditionally, many vaccines have been recommended for women during pregnancy for those reasons that you explained earlier. But can you clarify which vaccines are ones that are okay for pregnant women and which are not?
Right, so there is, common vaccinations that we give to children. And so one of them is varicella. That is not okay. And then there's the MMR, measles, mumps, and rubella. That is not okay. So those are the only two that are absolutely not okay.
Not okay. And what's in those vaccines that makes them not okay?
The virus itself is in the vaccine, so it actually is able to be transmitted, and it can cause problems. So we don't have an mRNA for those viruses. So what's so magic about the current vaccination is it's just a little piece, a little piece of the virus, not the whole virus. So when we first learned to do this, we had to start with something we knew how to do, and it was polio, and we were able to make something based on the actual whole virus. Now we can truncate and have just a tiny piece of the virus, so the immune system gets inspired. I like to say it gets educated. And a little education, like this is what you want to run into and attack. And then you don't have to have the whole virus in your body to educate your immune system now. You can just educate it on the piece of what we don't want in your body.
Now, you mentioned the mRNA vaccine, right? That is safe because it's not like the other ones that are not recommended.
Right.
But what about the Johnson & Johnson vaccine? That's not the same.
That's not the same, and that one, of course, is newer, and we have less data for it. But so far, we think it's okay. The mRNA ones, we really feel like we've done a lot of work, and a lot of people who are pregnant have been vaccinated. Their data now goes to the CDC. The CDC has analyzed it. They're not seeing anything bad at all. So, if you are really nervous, you want to get the mRNA one if you can, because right now, that's the one we know the best. However, if you were to do the risk-benefit ratio for any vaccination versus getting the virus, you're always going to come out better getting vaccinated. And there's not a lot of choice in every location. So we want you to be vaccinated so you are healthy during your pregnancy. That's just where we are. And the same if you're lactating, because now we know that the antibodies that the virus inspires in real people actually is inspired by the vaccination, shows up in breast milk, and protects baby.
We have much more on the COVID-19 vaccine and pregnancy. But before we cut to break, a reminder that you can connect with Dr. Sarah Berga at UBMD OBGYN, located at 1020 Youngs Road, Williamsville. Their phone number is 716-636-9004. Ahead, we'll learn about new information on the effects of the vaccine on pregnancy, lactation, and fertility. Dr. Berga weighs in.
Buffalo Healthy Living Magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living Magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living Magazine all over our hometown or go online anytime at buffalohealthyliving.com. WBBZ-TV.com.
I'm Samantha Latshaw. We're talking about COVID vaccine guidance for pregnant women and women of childbearing age with Dr. Sarah Berga and mother and COVID-19 survivor, Kate Glaser. Now, Kate, knowing what you know now, would you take the vaccine?
I actually just received the vaccine last week, and I was very, very proud walking into that center and was happy to give my arm to get the vaccine because I know what it was like to go through COVID and to have it when my baby was so young. So I got the vaccine for myself, my children, my husband, and also for my parents who are immune compromised.
So, was there anything in the information that you have learned today that may have dismayed you or definitely have locked in your decision?
Yeah, I think just, the hope that the vaccine brings to be able to get our world back to normal. Obviously, we are far from that, but we are really growing towards that with this vaccine. So I'm very happy with hearing what Dr. Berga has to say because there really is so much crucial information in regards to the vaccine.
Absolutely. Now, Dr. Berga, we know that pregnant women are not usually included in clinical trials. Many experts say that we are killing women by protecting them so much. Now, the Pfizer is now conducting a clinical trial to see how the COVID vaccine affects pregnant women. Do you think that's a good thing? What do you think they're going to find?
We've struggled at the design level for years how to approach this. So we start with the biggest, widest population. We call it generalizable population. And then when things look good and we want to test a special population, we test a special population. And pregnant women are a special population. But I think it's important to remember again that 20,000 women got this vaccination. They were part of the general population and they have done well. Actually, and all the data coming out are remarkable. So healthcare workers had a baseline rate of about 2.5% before the vaccinations began. A couple weeks after the second dose, that rate is 0.2%, a dramatic decline in contagiousness of getting, and we're exposed. Like, we're in a hospital. So we can't fully say we're not exposed. We can't 100% protect ourselves. We try really hard. But still we had a 2.5% baseline rate, and it fell dramatically after vaccination. This is what we want. And those antibodies, we don't know exactly how long they hang around, but the idea that they show up in breast milk, I mean, this is profound. This is awesome.
Now, are they finding that perhaps these women who receive the vaccination while pregnant, does that now transfer the protection to the baby while in the womb?
It does. It looks like it does. I mean, this is like all the stuff that's come out in the last few months, because remember, we had to get the vaccinations going and then we had to see what was happening. So we're at that stage now that we're starting to have information come rapidly to our attention, and it's very hard to keep up with. But I think what is really the bottom line is all the information so far is even more positive than we hoped.
Now, do you recommend at a certain stage, first trimester, second trimester, third trimester, to receive this vaccine? Because there is a small chance of, getting a fever because of the, like any vaccination, you get the flu shot, any type of vaccine, there's always that chance, and fevers we all know aren't good for pregnant women. Is there a certain time that you recommend that's best to take the vaccine?
I think this is like that funny argument, sin of omission and sin of commission. Like, it feels bad when you do something to yourself and you think you might be harming yourself, but you are protecting yourself. I mean, the really big problem is sin of omission, not getting vaccinated. So there might be an infinitesimally undocumentable small risk, which I think there probably is not from a transient fever. But if that were you're going to say there's a small risk, and then there's the risk of contracting COVID even while you're doing everything possible, and then you get really sick. And I think our guest here, Kate, is really a perfect model of what happens when you do everything right and you still get sick, and how not good that is for everybody.
Absolutely. Now, Kate, like you mentioned earlier, you were very sick with COVID when you were pregnant. Did your doctor tell you the reason why those symptoms were so severe for you while being pregnant?
You know, I think that when you're pregnant, you are immune compromised. So, you know, I was already sort of at risk, and I wasn't sleeping very well at the end. You know, she was bigger and it was hard to sleep. So obviously my immunity is not the best it should be. So I think that's why. I will never forget when I was at Sisters Hospital where I delivered Isla, and they had me take a rapid COVID test, and they came down in their full PPE. I knew at that point that I was COVID positive, and just the emotion going through knowing that I had contracted COVID, I felt a lot of guilt, and I was I felt a lot of shame for having contracted COVID. I was careful, but it happened. So I will never forget those feelings, but I'm now a living story of why people need to be so, so careful and really mask up and really just take every precaution that they can.
Absolutely. That sounds so frightening, Kate. And honestly, you know, as a mother who's soon to be mother, currently expecting my first child, hearing your story is definitely inspiring me to get the vaccine myself.
Yeah, one thing I will say is I had posted my story and it went viral. I posted it to social media because I knew that I wanted to tell my story and be kind of that example of why you need to be careful and why women need to band together. And I had responses from all over the world. I had a mom reach out to me from Italy, one from Australia. We really banded together, and I still keep in touch with those moms. And really, moms need to support each other during this time, and really obviously lean into medical advice and things like that, but really be peer-to-peer support, because everything is so unknown and you really have to band together and make that community.
Absolutely. You know, just during this time makes being pregnant so much more stressful. You were saying that you did absolutely everything to stay safe, yet you were still infected.
Yeah, that's the scary part. I was definitely masked up and I was definitely using every precaution that I could, but it still found me, it still infected me. But now I'm able to tell that story and really be part of history in telling that story. One day, maybe 50 years from now, I can really talk about this pandemic, and one day I'll be able to tell my baby girl that she was a survivor and that she's a COVID warrior. So I look forward to that conversation whenever we can have that.
COVID warrior, love that. So cute. Now, Dr. Berga, what does the American College of Obstetrics and Gynecology say about these vaccines?
You know, we had a big meeting last night, and we're just so worried that women who are pregnant will get the wrong message and that they will be actually overprotected in the way of prevented from getting the vaccination. So we had a lot of concern and that certain agencies would not give pregnant women the vaccination. So we really did this deep dive early on with the data that we had, and now every week we meet and we talk over the new data. And so it's really being actively, you know, as data come along, actively analyzed. So we were creating what we call a big data lake. So if you get vaccinated, you can go to data, and you'll get this little card and you can send in your data. And that data is constantly being reanalyzed as we go along through the pandemic. And so that's how we know all this. You can be part of the crowdsourcing for this study that's being done. And it's so reassuring because
Definitely.
These are real people who, you know, took the jab, as they say, and are now benefiting, but they didn't all know that right in the beginning. And we have to live and learn, unfortunately.
Right, this is definitely a very important topic. Just like we mentioned earlier, you know, pregnant women are more likely to have to be ventilated or perhaps even death because of the suppressed immune system.
And you know, the baby takes up space, so you can't breathe as deeply.
Definitely feel that.
And so that makes it harder to treat.
Yes.
Pregnant women if they do get a pulmonary complication.
That's a very good point, because when you are pregnant, it is harder to breathe because the baby's growing and taking up your lung space capacity.
Right.
So if you become ill with COVID, it already affects your breathing, and it explains why this is so hard for women who are pregnant, and it just scares me hearing this. But thank you so much for sharing this information and explaining why it's so important.
Yeah, it is important, and that's what Kate was saying. She was waking up, you know, towards the end, you've got something fairly sizable inside of you, and it's taken up a lot of space. So you can't sleep so well, you can't breathe so well. You know, you do not want to also be sick at this time. I mean, this is not what we want for anybody.
Kate, now that you have had this experience, what do you think? Do you think differently about the vaccines now that you are equipped with all this information? I know that you got vaccinated now, so that speaks volumes.
Absolutely. I was, like I said, very pro-vaccine, and even when I was pregnant and we were looking forward to hopefully having a vaccine one day, now it's here. And you know, even my friend group, we have all decided to get vaccinated together. Some of my friends are actually currently pregnant now, but they were very excited to take the jab, like Dr. Berga said, and really be able to protect themselves and their babies.
Dr. Berga, are there any women that you recommend for them not to get the vaccine?
If someone absolutely knows they're allergic to one of the constituents, maybe that's not a good idea. Although some people have actually just loaded up on antihistamines and gotten it anyway, or have taken their epi-shot with them. I mean, what we know about the COVID-19 infection in pregnancy is that women are more likely to die, almost 2 times as more likely to die. That's scary. 3 times more likely to need ventilation, 3 times more likely to go to the ICU. And then you think, well, what would make you not want to take this vaccination? I mean, it would have to be something really impressive that, you know, like the vaccination was really going to harm you. And we just don't have very much of that. So,
right. I guess it's the fear of the unknown, but you're educating us today that there's actually quite a lot of data.
There's a lot of data. You know, we've been actually pooling this data from the very beginning. We've got the resources. You know, we have these big computers now. We can amass all this information. We can make this data lake, and we can go and look in there and find out what's going on. So women have more symptoms from the vaccination than men, but it doesn't mean that the vaccination isn't working as well. In fact, we think it's working very well in both men and women. So
what would you say to women who are high-risk pregnancies? Are they okay as well to also take the vaccine?
Even more important.
Even more so.
So if you have a condition like diabetes, if you have hypertension, if you have anything that's complicating your pregnancy, don't delay.
What about women who have perhaps miscarried in the past?
Definitely time to get vaccinated.
So vaccinate, vaccinate, vaccinate.
I know it's boring. I'm sorry. I sound like a broken record, but I think it's really what I
People
need to say.
People need to hear it. Now, to the both of you, what advice that you give to women today before we close? Kate, you have such a remarkable story that I'm sure has touched many women at home. And Dr. Berga, you have so much information to share with us. What is the takeaway today?
Well, for me, it's do the right thing for yourself, your family, and your baby. And so, I mean, you know, we don't want you to be a number in a study. We want you to be safe. And so we have to actually help people overcome their fears in order to protect their health. And I know that that is hard, but vaccination saves lives.
Kate, what are your thoughts?
And I would say, you know, really be kind to one another and really, you know, take that vaccine for yourself and for others. Think about everyone else that you are around. Still continue to mask up. This is not over. So please be careful and just really, like I said, be kind, get the vaccine for others because that's most important.
You can connect with Dr. Sarah Berga at UBMD OBGYN, located at 1020 Youngs Road, Williamsville. Their phone number is 716-636-9004. COVID-19 is potentially dangerous to all people, but studies show that pregnant women who develop COVID-19 symptoms are at an increased risk for getting seriously ill. By following your doctor's advice and taking some extra precautions, you can enjoy a healthy, happy pregnancy while protecting yourself and your unborn child from the effects of COVID-19. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.
A production fee for the preceding presentation of Your Hometown Health Connection was made by Buffalo Healthy Living Magazine and its sponsors.